Mavericks, Mayhem, and Magic. I think most of us are aware of the vision, missions, and aims of Tenovus, but I'd like to just draw your attention to aim 4, to conduct and fund research to improve cancer outcomes and experience. One of the ways that Tenovus does this is through the Public Patient Innovation Grants. However, in order to meet the objective of bringing research closer to those it is designed to help, Tenovus wanted to ensure there was significant public input into the awarding of the grants. Therefore, the process was started, which resulted in the creation of the Research Advisory Group. In 2011, through the Involving People Network, Tenovus brought together 8 of us, along with Anita Hellman and Ian Lewis, the Tenovus Research team, and Neil Formstone, a Macmillan trainer who specialised in public patient involvement. He's also one of the Mavericks of our title. Over 3 sessions, we came together as a team and formulated the responsibilities of the group. I think it's fair to say that Ian and Anita did not, or really didn't want to know where these meetings would lead, and it is to their credit that they were willing to let the group develop organically. Actually, my abiding memory of these meetings is of Ian saying, "Do you want us to handle that?" And our answer being, "No, it's okay, we want to do it." These meetings were a mixture of, well, debate, argument, and no little chaos. But gradually, out of the mayhem, grew what I'm told is a fairly unique structure, where public patient involvement is at the heart of the project. We are not a box-ticking exercise or a token gesture. We are integral to the process, and I believe we add real value and insight. After all, our experiences as patients and or carer have made us reluctantly a type of expert. I'd just like to pause a moment and pay tribute to Neil Formstone, who passed away this year. Those who knew him know he was passionate about public patient involvement, and his input into the creation of the RAG was invaluable. I hope that some of his crusading zeal will always remain within the group and act in a small way as a legacy to his vision. Neil Formstone. So how do we go about awarding the Public Patient Innovation Grant? Initially, we request a summary of the research proposal. This gives us the opportunity for the widest number of applicants to apply. The applications are then scored against 4 criteria: quality, likely impact, value for money, and of course, public patient involvement. Successful applicants are then invited to submit a full and detailed application. Importantly, we also give constructive feedback to those who have been unsuccessful. It is important to point out that we do not act alone. We're not completely Mavericks, but a part of the method. Therefore, we do have other parties who input into the mix. We engage with peer reviews and fully consider the comments of these leading experts in our decision making, and our recommendations are put before the Tenovus trustees, who have the final say on the distribution of funds. I thank them for their support in this regard. The grants are then awarded, and for our grant holders, actually this is where the hard work begins. That's the mechanics of the exercise, but I'd actually like to share with you an example of how I think we make a difference. One particular proposal, which had gone through all these stages, including being strongly recommended by the peer review, was causing some disquiet in the group, and a particular difficulty to one member, who pointed out that the method of data collection was, well, impractical. His actual words were, "If I had been approached in that way, they would have had a punch on the nose." Actually, it's difficult to describe the atmosphere that ensued. It was intense, really, a mixture of passion, anger, and frustration. It was a worthwhile proposal, but it seemed little thought or perhaps public-patient input had gone into the method of collection and delivery. The research was not funded, and hopefully our feedback helped the researchers reevaluate their methods. I kind of hope we save some researchers from physical harm too. The story so far. In 2012, we awarded 11 grants to the tune of £215,000. And early indications are that this year we will make a similar contribution to the research community in Wales. I'm pleased to say that some of our grant holders, actually it's a little enclave downstairs, are actually taking part in the exhibition. Barbara Moore of Niska CRC, Jana Witt of Cardiff Medical School, and Mary Curry, who have 2 projects with us at the moment. And I would urge you to take a look at the impact they're making on the lives of people affected by cancer. I would like to thank Tenovus, actually, especially Ian and Anita, for the opportunity to contribute in this way, as it has been a very rewarding experience. I'd like to thank Neil for helping to create the group, but most of all, I'd like to thank my fellow rags. Actually, if I could ask you to stand up. Yeah, picture. I would like to pay tribute to the incredible amount of hard work you have done, and I know that you've more than repaid Tenovus for the faith they have shown in you. The future. We will continue to look to bring research closer to those it's designed to help, as it is vital that the public, the patient, and the community be placed at the heart of research. We have an important contribution to make. For us, there have been tears, there has been anger and frustration, a lot of hard work, and along the way some fun. As in amongst the Mavericks and the Mayhem, there has been a little bit of magic. Thank you very much.